What is the voiding phase in urodynamic testing? Imagine trying to understand how well your bladder works when you go to the bathroom. That's exactly what the voiding phase in urodynamic testing helps doctors do. It's a key part of a test that measures how your bladder and urinary system function during urination. This phase begins once the bladder is full and you are ready to urinate. During this time, the doctor asks you to urinate in a controlled setting, usually in a comfortable position that mimics your normal bathroom posture. As you start to urinate, special sensors measure the pressure inside your bladder caused by your bladder muscles contracting. At the same time, a flow meter records how fast your urine flows and the pattern of that flow. These measurements are important because they tell the doctor if your bladder is contracting strongly enough to empty properly or if there is some blockage or weakness. The main things doctors look at during this phase are the detrusor pressure, which is the force your bladder muscle generates to push out urine, and the urinary flow rate, which shows how quickly and smoothly urine is passing. They also measure how much urine remains in your bladder after you finish urinating, called the post-void residual volume. This helps determine if your bladder is emptying completely or if there's some leftover urine, which can be a sign of problems like bladder outlet obstruction or weak bladder muscles. This phase is especially useful for diagnosing issues like bladder outlet obstruction caused by an enlarged prostate or urethral strictures, or detrusor underactivity, which can happen in nerve-related bladder problems or after treatments for bladder cancer. Because urination can be influenced by psychological factors, it's important that you feel comfortable and relaxed during the test to get accurate results. Understanding how your bladder empties helps doctors decide on the best treatment options for conditions affecting bladder health and can also be important in managing bladder cancer. Remember, each person's situation is unique, so always consult with a healthcare professional for personalized advice. The voiding phase provides a real-time look at how well your bladder and urinary system work together during urination, helping to identify issues that might not be obvious otherwise.